This is the Foley checkoff video for the insertion of an indwelling Foley catheter into a female. In front of me I have the physician's orders, and I'm going to go ahead and review them. So we insert the indwelling Foley catheter for urinary retention for our patient Cody Taylor, date of birth 7/18XX. And now that I've reviewed my orders, I'm going to go ahead and gather my supplies. So I'm going to be bringing with me a soapy water basin with a clean washcloth in there because we're going to clean the genital area before we start the insertion of a catheter. I'm also bringing with me a dry towel and a larger towel, one to drape and one to dry. And then I also have my Foley catheter, which is a 14 French 5cc balloon, and it is sterile. Okay, so I have all my materials, and I'm going to go ahead and gather them, and I'm going to bring them over here. And I'm going to go ahead and grab an extra pair of sterile gloves and an extra catheter, so just in case I need to reinsert a catheter or my gloves break or anything like that. Okay, so now I'm going to go ahead and bring all my materials into the patient's room. So I'm going to knock, knock, knock. Hello, my name is Delaney and I'll be your student nurse today. Can I go ahead and start by checking your armband? Perfect. First and last name, Cody Taylor, date of birth, 7/18XX, and the MRNs match 0123654. Perfect. And I see you have an allergy band. Are you allergic to anything? No? Okay. Awesome. So today I'm going to be inserting a Foley catheter, indwelling Foley catheter, and this is just going to be like a plastic tubing that's going to go up through the urethra into the bladder, and it's going to help drain any urine that's in the bladder. It's also going to relieve some pressure that could be in the bladder as well for you. Do you have any questions for me? No? Okay, perfect. So I'm going to go ahead and close the curtains for privacy. I'm going to turn the lights on. I'm going to raise the bed. I'm going to lower the side rail. All right, and then I'm going to perform some hand hygiene and go ahead, and I'm going to have you lay in a dorsal recumbent position. So we're going to put our feet on the bed and our knees bent, and then I'm going to have you relax your thighs and rotate your legs externally. Perfect. So for this procedure, I am going to have to expose your lower half, if that's okay. Awesome. So I'm going to get my clean gloves on real quick. Okay. So I'm going to go ahead and lift up your gown. And I'm going to drape my clean towel. Perfect. So now I can go ahead and start to clean the perineal area. So I'll get my soapy, appropriate temperature washcloth, and I'll clean the outside far labia majoris, the outside near labia majoris, the far labia, the near labia, and then down the middle. And as I'm going down the middle, remember I did top to bottom, so it's least contaminated to most contaminated. And I also located the urinary meatus, which is what I'll be inserting the catheter. So now I'll take a clean, dry towel, and I'll go ahead and dry off the patient. Awesome. So those are done, and I can remove my gloves. I'm going to perform hand hygiene, and now is the time where I will organize my work area to create a sterile field. So here I have my trash can at my patient's feet. I have my bedside table appropriate distance away so I don't have to cross my sterile field. I'm going to go ahead and start by opening my catheter. Okay, and I start by opening away from me, and then to the sides, and then towards me. Remembering that I can only touch the outer 1 inch because that's the only thing that is considered non-sterile at this point. So now I'm going to take my sterile drape, remembering to only touch the outer 1 inch of it because that's the only part that's contaminated. I'm going to carefully open it up, and without crossing the sterile field, I'm going to lay it underneath the patient. If she can, I would have her lift her buttocks. So I'm just going to slide it under there as much as possible. Perfect. And now I'm going to go ahead and don my clean pair of gloves. So, remembering to maintain sterility, I'm going to carefully only touching the inside. Now that this one's clean, I can go ahead and perfect. Now I'll keep my hands above waist level to maintain sterility as well. Here's my fenestrated drape. We will not be using this, so I can go ahead and toss that. So now I can go ahead and just organize my work area just a little bit more. Perfect. So I'm going to open up my sterile solution, or my antiseptic, pour it over my cotton balls. It's my iodine. And now I'm done with that. I'll place my forceps over my cotton balls. Now I can go ahead and remove the cap of my saline and connect it to my catheter. I'm going to go also take off the covering of my catheter. And then I am going to put the lubricant in my tray. And then I'm going to take the last about 1 to 2 inches of my catheter and roll it into the lubricant. Okay, now that that is clean, I can go ahead and clean my patient. So I'm going to, with my non-dominant hand, hold the patient's genitalia open. Okay, and now I will start with the one cotton ball at a time, cleaning from top to bottom, least contaminated to most contaminated. I'm going to clean the outside far labia majoris, and then the outside near labia majoris, and then the inside labia, far labia, and then the inside near labia, and then down the middle. And I also still see the urinary meatus, which is where I'll insert the catheter. So now, keeping my hand in place, this is now my contaminated hand on the genitalia. So now with my sterile hand, I'm gonna get my catheter ready. I'm going to grab it about 3 inches away from the end and coil the rest of my hand. And I'm going to explain to the patient that she might feel some kind of pressure, but just to take deep breaths until the pressure subsides. So now I'll insert the catheter about having her breathe through the pressure, and then I'm going to insert it, once the pressure subsides, I'm going to insert it about 2 to 3 inches in further until I see urine. I see urine, and if I were to have touched the catheter on the labia or on the linens, I would have to start over because it's no longer sterile. So now I see urine. I'm going to go ahead and proceed and push it in about 1 to 2 more inches. Perfect. And if there was pressure, I would have twisted it, but I didn't feel any pressure, so that was good. So now I'm going to let that kind of just hold that in position. I'm going to take my non-dominant hand now, and I'm going to go ahead and grab my syringe and fill up the balloon. If my patient were to have complained of any pain, it would still be in the urethra, and I would need to let the water drain out of the balloon and push it in about 1 inch further into the bladder. So now I can go. There is no pain, so I can go ahead and continue filling up my balloon. Awesome. Okay, now that is done, I can go ahead and hang the catheter on the side of the bed. It's going to be on a non-movable part of the bed. Okay, and I'm also going to take my non-hyperallergenic tape and tape this to the upper thigh with enough slack so that if there's any movement, it doesn't pull out. And I am going to, I can go ahead and move this back. And if she needed to be cleaned anymore, I will go ahead and clean her now, but she looks pretty good. So I can go ahead and take all of my materials and throw them in the trash can. Okay, I can go ahead and remove my gloves, perform hand hygiene. I will go ahead and remove this towel. Go ahead and re-drape the patient. Okay, and then I'll ask her, are you comfortable? Is there anything I can get for you? You feel much better? Awesome. Okay, I'm going to go ahead and turn the light back to how it was. I can raise the side rail and lower the bed back down. You know where your call light is. Okay, do you have any questions? No, and you're comfortable? Perfect. So now I'm going to do my documentation section of the video. And so this was performed at 1300 on November, so 11/25/2020. And the catheter that we used was a 14 French catheter. We put 10 milliliters of saline solution into the 5 cc balloon, and the pericare was performed. We expelled, there was about 750 milliliters of urine in the bag, and it was clear and yellow. It was clear and yellow, and the patient tolerated the procedure well. She stated that she felt much better after the catheter was fully inserted. And yeah, I believe that is it. That concludes it. All right. Thank you, Cody Taylor. We'll see you soon.